All right. So, good afternoon. I'm Dr. Sheehan from Sheehan Health Improvement Center. Here is another nutritional blood chemistry case study. This one is another infertility case, and it consists of infertility, insulin resistance, inflammation, and food sensitivities. So let's go through a little patient background. Let me get this out of the way. All right, so PS is a 35-year-old female. Chief complaints were exhaustion, pelvic pain, joint pain, infertility, and weight gain. She had tried to conceive previously for 12 years and had one adopted son because it was not working. So a little background, I had seen her years ago, and she wasn't able to get over her problems. And years ago, I told her that her problem was sugar, food sensitivities, and that she needed to cut these things out if she was to get over the hormonal issues she had and, start having kids. And we didn't do blood tests back then. So I just used muscle testing, NRT, nutritional response testing. And even though it was right, it just wasn't real enough. So a couple years ago, she messaged me. I became friends with her. She's really nice. And she said, do you think that functional medicine would help? Whenever anybody comes out and says, do you think this would work? It'll work if a person does it. And so I messaged her back because I'm friends with her. And I said, you should actually try it. And if you can follow through with what I tell you based on your nutritional blood chemistry and nutrition response testing, we can give it a try again. I can't really promise anything. But it's definitely worth a try. And she had already been through fertility treatments and they weren't working. And so they ended up adopting a son, and he's awesome little family. And anyway, let's get into the case. So step one was ordering the right test with Avexia Labs. So why Avexia? So I was suspecting underlying imbalances, and I wanted to make them more real. Remember that lab testing we don't really use it as, how would you say this? We use muscle testing, lab testing, and symptom surveys and patient histories. And so it's another tool. And so it's a communication tool because, I don't want to use the word diagnosis because it's not really diagnosing, but it shows these imbalances when you use nutritional blood chemistry so that you can make it more real to a patient. It's one thing if you tell a patient, well, you need to lose weight, and they don't know how much they weigh. You get them on the scale and they're like 275. They're like, yeah, I know I need to lose weight. It's the same thing with blood testing. Unless you make it real to a patient, it's not really real. I'm going to turn off my phone while I go over this. So just keep that in mind. But we have our own panel through Avexia that we put together, and we got a really good price for our practitioners. It's called the Sheehan Standard Lab Panel. It includes over 70 biomarkers, such as the thyroid panel, including TSH, free T3, free T4, the TPO, and the antithyroglobulin antibodies, very, very important for our food sensitivity testing. The iron panel, including ferritin, TIBC, serum iron, and others. Inflammatory markers, such as the hsCRP and homocysteine. Nutrient markers, such as vitamin D, B12, magnesium. Metabolic markers, fasting glucose, hemoglobin A1C, and full lipid panel, and many other things, and their food sensitivities too, okay? And this is very, very important because it gives a good overall view of the patient. It's you need to have a yardstick to measure them by, and that's what we use the Sheehan panel for. We run this on all of our patients. So the Avexia advantage. Avexia's panel was cost effective. It's up to 80% savings off traditional labs. So it's a good template. The thing is, when we run an office, the more automated you can make things, the less likely it is that your staff and patients and whoever else is on the other end, which is LabCorp, will mess it up. And so you want to have a system that then you can customize if you need to. So you can put add-ons into it like the cortisol, DHEAS, or else you can do the ApoE testing for Alzheimer's. You can do one for cardiac markers. You can do all sorts of things. But for non-licensed practitioners, Avexia's internal physician network, EIPN, would facilitate ordering under physician supervision for just a $15 requisition fee. So in other words, I have a doctorate in chiropractic, and it's in my scope of practice in Pennsylvania. But if you were in another state and you were like, well, I'm a natural health practitioner or something like that, or a naturopath, and they're not clearly licensed, you can basically use their EIPN, and so you can order through Avexia. So let's go over the NBChem. So these are her results. Let me see if I can put them somewhere where they're not going to get in the way. So these are her results, and it's kind of cool because what happened was she came in 12/3/22, and I think it was like 6 weeks later she was pregnant, and we retested on 3/17/23. And why did we do that? Because she actually got an infection. So what you're seeing is the beginning labs at 12/3/22, which is on the right, and you can see that she has food sensitivities down here, blood sugar problems. I'll put myself up here. Okay. Immune challenges, inflammation, B1 deficiencies, vitamin D, and then very low B9 and B12, and then thyroid stress. Let me go over that a little bit more. So the food sensitivities are here. Okay. If you notice, what are these testing? These are not testing food allergies. These are sensitivities. These are measuring IgG, not IgE. IgE is an allergy. IgG is an immune system response. And you can see that her immune system response calmed down to a lot of things. She's got sensitivities to eggs, wheat, dairy, gluten, more egg. And you can see that with the post, they all calmed down, and the gluten went down to normal, and the egg yolk went back down normal. So I told her, eat lots of gluten in it. No, I didn't tell her that. It just means that her immune system is not reacting to it anymore. That's a healthy response, okay? With blood sugar, you can see that she was very insulin resistant. Where is her? I always have trouble finding it. So she had a high fasting insulin, and that went from a 10 to a 7.4, so it's, you could almost say optimum. Her blood sugar, if you notice, this is the reason why this will get missed under standard medical labs. We actually started referring to these instead of blood sugar problems, but more like insulin resistance. The reason being is that if you're communicating a blood sugar problem to a patient and they don't have altered blood sugar, they say I don't have a blood sugar problem. But I've only seen one doctor run one time a fasting insulin, and that was at the request of the patient. But a lot of these cases with insulin resistance, you'll find it when you run a fasting insulin. So you can see that her glucose, her fasting blood sugar was fine. Remember, this is the least reliable indicator of blood sugar stability, as per Mosby's. Okay. Fasting insulin, that's one of the first things to go off when insulin resistance happens. So you can see that hers is happening right here. And we're going to go over these in the panels in a second. Also, she has high triglycerides. Her triglycerides were more than half of her cholesterol and 4 times her HDL. Okay, it should be no more than twice your HDL, and it shouldn't be more than half your cholesterol. So she has really bad insulin resistance. We don't put the urinalysis results on each one of the NBChem results here, but she had abnormal results on her urinalysis pointing towards an immune system challenge. This happens to a lot of people that have insulin resistance. And inflammation, she had high uric acid. Remember, that goes along with insulin resistance. She also had high CRP. Where's the CRP? Here it is. It was, I can't tell if this is an 8.9 or 6.9. My eyes are not as good as they used to be. It's high. But it went up to 34. Now, remember in our beginner course, the NBChem beginner course, which goes over primarily the first 4 things, which are food, blood sugar, immune system challenge, and inflammation. When you see it in single digits, we're talking about chronic inflammation. When you see it in double digits, you're looking more at infection. What did she have? She had an infection. For a long time, she was battling like a yeast and bacteria challenge. What else did she have? She also has low T3 uptake. It was low when she wasn't pregnant and went down. Remember, T3 goes down when a woman becomes pregnant, and sometimes T4 will go up because they're not converting that much from T4 into T3. So her T4 actually went up. and then a B1 deficiency. You can see a lot of people with insulin resistance are going to have a B1 deficiency, and you're going to have that with evidence of that is low CO2, but also a high anion gap. Remember, the gap is found by adding together the sodium and potassium, which would be 142, minus the chloride and CO2 together, so that's 120. So she's got an anion gap of 22, and it shouldn't really be more than 12. So she's got a B1 deficiency. She also has low vitamin D. Where is the vitamin D? There it is. Notice that a lot of these improved. The reason why a lot of them improved was because of the fact that she went through care. But some of them got worse because she got that infection. And when you get pregnant, what will happen is it'll throw off those thyroid numbers too. Okay. And also very, very important is, see how she has high homocysteine? That correlates to very low folate and B12. Notice that the folate came up, the B12 went down. We had to give her more B12. Okay. That was on post second follow-up. You can also see, like we went over in the beginner NBChem, when you see a low TSH, start thinking a brain stress pattern. That's a hypothalamus pituitary adrenal thyroid axis problem. And so she had that too. Notice how it's like you can tell that her labs got better, but then she had the alterations from being pregnant. So let's break it down a little bit more so you can understand it a little better. Okay, so let's interpret results. Using the NBChem lab report, several suboptimal patterns were identified. Remember, if you basically handle these things in order, the first four things like we just had on this previous page, you're going to get results. Remember, we always put this together with nutritional response testing. But the reason why we do this is for communication to the patient, so they have something to measure that they got better. And also, when I started running lab tests, it made it much more real. Like, hey, this person really does have insulin resistance, or hey, this person really does have an immune system challenge, or hey, this person really does have vitamin D deficiency, a folate deficiency, a B12 deficiency, a thyroid problem, whatever it is. It makes it much more real. So then you can measure actual improvement, not just symptomatically. Because remember, if it's like you want symptomatic results, that's very, very important. But if you don't show black and white results, okay, you're not showing results either. You've got to show results on all fronts. So, by the way, it's also, when we were doing this, we used to use a computerized functional health report through another company so that we could learn how it was being done. We found that we could do it better by using the nutrition response testing, history, signs and symptoms, and then the NBChem. But if you want to order the functional health report, that always helps you learn. You're like, oh, wow, look at all these markers here. It just kind of gets in your brain a lot quicker. Okay, so the first thing is the food sensitivities. A pattern of IgG food sensitivities indicates possible gut permeability and digestive dysfunction. Remember, it's not an allergy, okay? Possible gut permeability and digestive dysfunction. You can also have immune system dysfunction. Note the improvement over the 3 months. Thyroid antibodies were not tested. It would be wonderful to have this data as thyroid autoimmunity makes avoiding the foods especially critical. Remember that we went over that in the beginner nutritional blood chemistry course. We run the anti-TPO and anti-thyroid globulin. Oh, yeah, that's right. We didn't do them. But the reason why we run them is not to screen for thyroid. I mean, it helps to screen for thyroid, but if you come up with positive TPO or thyroid globulin antibodies, you definitely need to avoid gluten and dairy until proven that you don't have a problem with Cyrex. And even then, I would say it's suspect. I tell everybody with those antibodies, hey, you have an autoimmune tendency, avoid gluten and dairy. That's the number one thing that triggers it that we found. Okay? But you can see that she made improvements here. All these numbers came down. Some went back to normal. I tell her avoid those foods, but just understand that she's made improvement. And when you see a person make improvement, it really helps motivate them. Okay? Insulin resistance. This was the big thing. She came in between her 12-year appointments, when she first came in years ago, in 2011, what it was. She gained, I think, about 50 pounds, and she developed severe insulin resistance. And it was really interesting because after she got pregnant, she started losing weight when she started the program. And I think it was December 2022. She started losing weight. She kept on losing weight through her pregnancy until the end of her pregnancy. Then she gained a little bit of weight from before. So it was weird because she lost so much fat on her program while the baby grew in her uterus that she didn't really put on any weight. It was kind of incredible. Note that great improvement. She goes from having a PCOS pattern, remember, with insulin resistance, and that goes right along with infertility, to practically perfect blood sugar. Yeah, you can see that this fasting blood sugar came down. It wasn't high in the first place, but that fasting insulin came down really well. Her HA1C came back to perfect. Her HOMA-IR came back to perfect. And her triglyceride HDL ratio was still a little bit high. This is primarily achieved through diet coaching, cutting carbs, and sensitive foods. Yeah, she just cut the sugar, she cut the gluten, cut the dairy, cut the eggs, and boom, it came right down. By the way, this greatly reduced the inflammation in her body. The CRP was because she had that infection, remember. Okay, so let's go over immune system reactivation. So she has some immune activity of 1222, and by March, she was dealing with sinus infection and boils on her arms, which probably accounts for the immune markers looking worse. So her white blood cells went up, okay? She went from a chronic inflammatory pattern, this is what a chronic inflammatory pattern looks like over in here, to more like an acute inflammatory pattern. This is what an acute inflammatory pattern looks like. So the chronic inflammatory pattern, you're going to see white blood cells slightly elevated. You're going to see platelets go up. You're going to see hsCRP in the single digits, so it's 8.9. Homocysteine, remember that's a B9, B12 deficiency, and also fibrinogen. But when you see like an acute inflammatory pattern, white blood cells go up, and you'll see neutrophils go up more, lymphocytes dip down. That's more of an acute inflammatory pattern. And the hsCRP, it would go into double digits and even triple digits. Her fibrinogen score went up even further, and that was just because she was very, very inflamed from that infection. So it was interesting that the overall scores stayed the same, but the pattern changed. And let's look at the iron balance and anemia. So she turned slightly more anemic. And why would she do that? Well, she was pregnant. And slightly low iron on her second test. That's just because she's pregnant. And so you'll see it over here. This, remember, we break it up into high iron, low iron, and the anemia assessment over here. And so you can see that she doesn't have any findings of high iron, but you can see when she started, she had like low iron saturation, and that was about it. And you can see that her UIBC went up, tending towards more iron deficiency, and her saturation went down. That always happens. Well, maybe not always, but most of the time with pregnant women. And you can see her hemoglobin really went down, hematocrit went down. Her MCV went up. Now, why would that go up? Well, because her folate went up. And so basically, her red blood cells got bigger. The microcytic anemia was like reversing. But her RDW went up. Remember, that's red blood cell distribution width. And as you correct a B9, B12, B6, and iron deficiency, originally you'll see the RDW go up as your red blood cell widths normalize. You'll have a mixture of small ones and large red blood cells. So that was also interesting. So like I said, this is a very interesting case because you actually see correction of the underlying causes, and then you see pregnancy on top. Now you know what to look for. And here we have the B1 assessment. It actually got a little bit better, but she was also pregnant, so it didn't get all better. But you can see how her CO2 actually went down, but the anion gap went down. Remember, the anion gap is the difference between the sodium and potassium added together minus the chloride and CO2. And so it went from a 22 to 9.5. Her vitamin D went back to normal, I'd say optimum. And you can see her B9 and B12. You can see that's also reversing back to normal as well, except for the fact that her B12 got worse. By the way, this was before we started using methylated Bs from Doctor's Research, B-stress complex, and I think the other one's called B6, 9, and 12 or something like that. Methylated Bs. We use those two now. We also use a lot of B12 2000 from Biotics. Even though it's not methylated, I've seen it always work. And so you can actually see that we didn't do that. We just used standard process, I think, with the folic acid B12, and her B12 went even further down. Okay. Her system survey correlation. The standard process system survey revealed multiple areas of stress, but especially cardiovascular stress, liver gallbladder stress, hypothyroid, and hypoadrenal. This is pretty typical. Remember, you don't use a symptom survey to diagnose, but for follow-ups. Remember, if that score goes from 100 to 50, they're 50% better symptomatically. So the treatment plan. So in December 2022, a nutrition response testing findings, mainly gallbladder stress and immune stress bacterial pattern. Hey, surprise. The protocol was Cholacol, AF beta food, Cataplex D, and folic acid B12. Remember that B12 wasn't enough to actually correct that B12 deficiency. Or I should say insufficiency. It wasn't really, quote, deficient yet. Her chief complaints were exhaustion, joint pain, and pelvic pain. They all started improving, by the way. And then she got pregnant, then she had pregnancy on top of it. That's a welcome change. So as you can see, I use very, very simple protocols. In fact, I don't really use protocols. I mean, we do all of it with muscle testing, but we like to back it up with blood testing. I mean, I don't usually like to have a person more than on 1, 2, 3, maybe 4 supplements. I like to do a lot of follow-up and get the person's diet dialed in, get them doing exercise, therapeutic exercise, chiropractic, and stuff like that to make the changes rather than lots and lots of supplements. Because they get supplement exhaustion, you know what I mean? And then they're like, oh, I don't want to do anything. And then you can't get anybody better if they quit. So, a note on folate. MP's folate level was very low in December 2022. This correlated with elevated homocysteine. We use folic acid B12 from standard process. We were not yet using methylated folate. Right now, there's all this rage about methylated folate. Now it seems like there's some pushback. You can do too much of it. We use folic acid B12, and it worked fine. It's fascinating to note that even without using methylated folate, her folate levels and homocysteine both improved, and she was able to get pregnant. Currently, we would use a different approach, but the old way is still very effective. So this is how we use it. If I see evidence of B1 deficiency, B9 deficiency, B12 deficiency, and B6 deficiency, I use B-stress complex from doctor's research. If we just see evidence of folate and B12 deficiency, we use B6, B9, and B12 from doctor's research. That's it. For a while there, we were using B12 2000. That was also working great, but that wasn't methylated, so I wanted to switch along with the times with methylated B vitamins. Okay, what was the outcome? As of March 23rd, she was 10 weeks pregnant. By October, she'd given birth to a healthy baby boy, and she has had her ups and downs since that time. But overall, she's done well, continuing her monthly nutrition response testing checkups. By April 2025, she's pregnant again. So she had a 12-year hiatus, adopted, and now she's on her second pregnancy. I said, how many are you having? She goes, I don't know. So it's pretty cool. Okay. So why order Vexia Labs through us? Your enrollment fee is waived. That's $250 value. You access our custom panel so you know what the heck we're talking about. That you can start ordering as soon as you sign up. Access our custom lab panel discount pricing. 10% off labs that are already 80% discounted. Functional health report with supplement recommendations. If you sign up for Vexia Complete, it's a $50 annual fee. Also, when you sign up underneath us, we get a very small commission, and that helps us give you all these case studies for free. Okay, take the NBChem course. You can use this QR code. An in-depth teaching on each lab marker, thorough review of the top 4 most vital nutrient blood patterns, food sensitivities and digestive patterns, insulin resistance pattern, immune stress and inflammation, iron balance and anemia. Start using material and ordering lab tests right away to help your patients. Get this course. It's awesome. Thank you.